Today, being the 7th day of the 365 days project, we are here to deal with the final aspects of pneumonia. Coming to the risk factors and complications. Anyone can get pneumonia, but certain people are at a higher risk. These groups include infants from birth up to 2 years old, people aged 65 years and older, those with a weakened immune system because of certain diseases, or those who are under the use of certain medications like steroids or certain cancer drugs, people with chronic conditions like cystic fibrosis, asthma or diabetes, those who smoke or drink an excessive amount of alcohol, those who have swallowing problems or any other mild to severe immobility issues, those who've recently been hospitalized, especially those who've been on prolonged ventilatory support, people who have recently encountered a cold or any other respiratory virus, and lastly, those who've been exposed to lung irritants such as pollution, fumes, and other chemicals. Pneumonia can also cause various complications. These include worsened chronic conditions like congestive heart failure and emphysema. In certain cases, pneumonia also increases the risk for heart attacks. Other conditions include bacteremia, which is basically the bacteria from the pneumonia infection which infiltrates your bloodstream and causes a dangerously low blood pressure, septic shock, and in some cases infection or even organ failure. A lung abscess. A lung abscess is a cavity in your lung that is filled with blood and pus. Usually, these can be treated with antibiotics, but in some cases may need to be surgically drained. Other infections include pleural effusion, which is a collection of fluid around your lungs, and this may also need to be surgically drained. Finally, another worsened condition, in fatal states, pneumonia can even cause death. Coming to the treatment of pneumonia. Your doctor will prescribe a treatment depending on the severity of your symptoms. Firstly, prescription medications. Depending on the cause of your pneumonia, your doctor will prescribe certain medicines. For example, bacterial pneumonia can be treated with oral antibiotics. However, antibiotics cannot treat viral pneumonia, and a doctor can only prescribe an antiviral. Keep in mind that usually viral pneumonia in most cases can be treated with rest at home. Antifungal medications are given for fungal pneumonia, but these take several weeks to heal. The next is at-home care. The doctor will prescribe over-the-counter medications to heal your pain and fever. These include aspirin, ibuprofen, and acetaminophen. A cough medicine can also be given to help calm your cough, but keep in mind that your cough helps remove fluid from your lungs, so you do not want to eliminate it entirely. In very severe cases, hospitalization is required. In hospitalization, your treatment includes respiratory therapy, IV injection of antibiotics, and oxygen therapy with the help of a face mask or ventilator. Us budding doctors and professional specialists always believe that prevention is better than cure. So how do we prevent pneumonia? There are a number of vaccines which are your first line of defense to help prevent pneumonia. Your first vaccine is Prevnar 13 and Pneumovax 23, which help prevent the pneumococcal bacteria from causing this condition. These are recommended for children under the age of 2 years old, adults over the age of 65 years old, and those with chronic conditions between 2 and 64 years of age. Your next vaccines are your flu vaccines and HIB vaccines, which help fight against the Haemophilus influenza type B bacteria, which causes pneumonia and meningitis. This HIB vaccine is recommended for children under the age of 5 and all unvaccinated children as well as adults who suffer from chronic conditions, as well as individuals who have recently undergone a bone marrow transplant. In addition to vaccines, there are other tips which can help you prevent against this condition. For example, if you're into the habit of smoking, please try to quit. Regularly wash your hands with soap and water every day. Cover your coughs and sneezes. And lastly, maintain a healthy lifestyle to help strengthen your immune system. This includes a healthy diet, regular exercise, and lots of rest. Take care, stay safe, and thank you very much.